All right, hi, my name is Isaiah Chu. I'm a student physical therapist here at Rocky Mount University. Today we're going to be doing a video on how to give estim onto a patient. So some indications of estim are going to be increased range of motion, reduction of muscle spasms, pain, and muscular re-education. Some regional contraindications are if a patient is pregnant, you don't want to put it on their abdominal area or like their lumbar area. You don't want to put it on their gonads or their reproductive areas. You don't want to put it near the phrenic nerve, and you don't want to use it if the patient has any active infections or hemorrhage of any kind. Some absolute contraindications are going to be active cancer, DVTs, if they have a pacemaker, or if they have epilepsy. So today our patient is going to be Brandon. He's 18 years old. He recently had a right ACL reconstruction. So we did a little bit of testing already. He's having trouble activating his quads, and when he performs a straight leg raise, he's having a little bit of extensor lag. His pain levels are pretty minor right now. He reported a 1 out of 10. So today we're going to be performing a biphasic estim, and it's going to help with quad strengthening and neuromuscular re-education. All right, how you doing, Brandon?
Good.
So I heard you recently had a right ACL reconstruction. Okay.
Yeah.
And it looks like during your straight leg raise, you're having a little bit of an extensor lag issue. All right. So today we're going to be doing estim. We're going to be doing biphasic. Have you ever used estim before?
Yeah.
You have? Mm-hmm. Okay. So you're pretty familiar with how it works, and it's just going to give you a little bit of contraction.
Yeah, it'll kind of, be a little tingly.
Okay. Perfect. And you don't have any history of like epilepsy or cancer, like DVTs or anything? All right, perfect. I'm just gonna inspect the skin. All right, everything looks good. You don't have any impaired sensation, so everything you could feel, I'm pressing down, everything feels good? Yep. All right, perfect. So, coming over to the machine. All right, so the first thing we're gonna do, obviously, turn it on, duh. Give this a second to boot up. So we're going to be using biphasic. We're going to be doing a total of 10 minutes. Rate's going to be 50, and the pulse duration, pulse width is going to be 200 microseconds. We're going to be doing about, the duty cycle is going to be 1 to 3. So what that means is going to be a 1 to 3 ratio. So it's going to be 10 seconds of contractions, or 10 seconds this machine is going to be on, and then 30 seconds of rest where there's just like a lack of estim basically. So the reason why we're doing this, the proposed mechanism of action is we're trying to get that quad to fire more effectively, and try to get rid of that extensor lag. The MVC on this is going to be about 50 to 70%. So we're going to get that quad to contract 50 to 70% of what it can do, like without the use of estim. All right, so I'm gonna put this on this. Sorry, it's a right quad. So no impairments or anything. All right, everything feels good. Mm-hmm. Okay. I'm gonna put this on top right here, and then the other one I'm gonna put closer to his patella. All right, perfect. I'm going to turn it on, and then the intensity is just based off what the patient can tolerate and like what's comfortable to them. So just tell me when you start feeling it.
I'm starting to feel it. Keep going.
Okay.
It's just kind of tingly right now.
Okay.
You can keep going.
Just tell me when it starts feeling intolerable.
Okay, keep going. Still kind of tingly. You keep going.
Keep going?
Yeah. It's almost there. Alright, that's probably good.
Okay. And press start. Okay. Okay. So it's going to run for about 10 seconds on, 30 seconds off. We'll do this for about 10 minutes. Is it still going?
It just turned off.
Okay, 10 minutes has gone by. He's done about, 10 reps or so. I'm gonna press stop. Take these electrodes off of him. Did everything go well? Okay.
Yeah.
All right, I'm gonna inspect the skin afterwards. All right, everything looks good. You can still feel perfectly fine.
Yep.
All right, awesome. So that's what biphasic is. Yeah, perfect.